So, who are you? What's your experience with first aid?
So my name is Dylan Snow. I am a critical care flight nurse for Mayo One as well as a flight paramedic. I have both certifications.
Alright, so the first question. We learned the protocol for an unconscious person for lay responders in our first aid and CPR class. What is the protocol for EMTs and first responders when the patient is not breathing?
Always start with scene safety. Make sure that you can effectively take care of a patient who's unconscious and not breathing safely. If you can't do it safely, then there's no need to even attempt it, because if you're injured while trying to help the person, now we have two injured people, which makes the situation worse.
Alright, question number 2. What is the protocol, or is the protocol different for children?
For checking, if look, listen, feel for airway and a pulse is going to essentially be the same. You may feel in a different spot for a child for a pulse, and then your rate of breathing would be different from one breath every 3 to 5 seconds for a child or an infant, and then for an adult would be one breath every 6 seconds.
And question number 3. What else is different about the procedure for infants?
Infants, the biggest thing is making sure, I would say, that you can effectively open the airway, because with an infant you're going to have a bigger head and a smaller shoulder, so what ends up happening is the chin kind of rolls down onto the chest, and then when you try and breathe for him, if the airway is not open, you're not actually delivering a breath. And then keep in mind, with infants, it's a very, very small breath, and you don't want to over-inflate the lungs, because the air always ends up going into the stomach, and then you end up with patients puking, and that ends up in the airway, and then if they do survive, you have infections and other situations down the road.
Alright, number 4. What is the difference in protocol with unconscious people who are breathing?
Open the airway, make sure that they do have, in fact, effective breathing, not just something that would be agonal. Can look like breathing, especially if you've never seen it before. So make sure that the patient is actually moving air. If you're not worried about trauma, you could roll them onto their side in case they do vomit. That would protect the airway a little bit better and make it easier to deliver a breath. Roll them back if they needed it.
Alright, number 5. Is the protocol any different for children?
Again, it would just be more with the child, infant, making sure the airway is open. With an infant, you're definitely going to want a towel works really well to put under the shoulders to make sure the airway is open, smaller breaths, and then a little bit quicker compared to adults.
Alright. Any other specifications for infants?
Not really. Again, you'd be checking for it's usually a brachial pulse is the easiest to find on an infant, and then just kind of making sure the airway again is open.
Alright, number 7. What is the best way to know when to call 911?
If you have a gut instinct that you feel like you should dial 911 because of a particular circumstance, wherever it may be, I would encourage you to call, explain why you're calling, who you are. If it's safe, I would stay at the scene and make sure that help does arrive, and then you can speak to law enforcement or to EMS when they arrive and state why. And no one would ever fault you for calling if you had a genuine concern. They would encourage it, and if someone was like, this wasn't something you should really call for, you would get education. But I would always encourage you to call 911. It doesn't cost anything for Gold Cross or Mayo One to show up. If we don't transport the patient, we don't charge. So call every time.
Alright, number 8. Is there anything particularly different when someone is alone?
If someone doesn't have a pulse and you're alone, you would need to do 2 minutes of effective CPR and breathing prior to stopping and going and calling 911 or finding someone to help you.
Number 9. What about a large crowd of people?
If you can have someone help you to kind of make a little bit of a circle around the patient who needs help, is great. If you have someone that happens to have a blanket, you can have a couple people hold blankets just to kind of try and give some privacy. But if your genuine concern is for the patient, I would encourage you to really try not to focus on the crowd around you, focus on the patient and do a really good job, because no matter what, if you're in public people will come out of the woodwork to watch what's going on.
All right. 10. What should you do if you have no cell phone service or no access to a phone?
I would try and take care of the patient for as long as I could, understanding that after 10 minutes, 15 minutes tops, if you were the only one doing CPR or rescue breathing for a patient, at that point, you're probably, whether you want to admit it or not, are going to be very tired and probably not providing the most optimum CPR or rescue breathing at that point. So at some point, you are going to have to notify the authorities, and that would be a very difficult situation to have to step away from. But after 15, 20 minutes, I would probably have to just find some sort of way of making sure I could get a hold of someone.
All right. 11. How can you create privacy in a public place?
Again, if we're talking public in terms of we're at a concert or something like that, chances are you're just going to have to make do. You're always going to have the cell phones out. You're always going to have something like that. If you needed to move the patient because you couldn't effectively take care of them, sometimes that is the best option. If you have, again, with EMS, we have stretchers and we have ability to move a patient a little bit easier, but sometimes you just need to pull the patient somewhere private. If you're in a bathroom, you can't take care of someone very effective. You have to do what you have to do to take care of the patient. And unfortunately, try to really not focus on the public and just pay attention to the patient.
All right. And 12. What about AED protocol?
When in doubt, go get it. Follow the prompts. Do exactly what the AED tells you to do. You don't need to put the AED on if you can feel a pulse. People can get a little bit excited sometimes and want to shock a patient who has a pulse. I would still, if you're unsure, go get it, have it readily available. You can open it up, you can even turn it on. It won't go forward until you do the step it's telling you to do.
All right, and the last question. Is there anything else you think we should know?
Really pay attention to scene safety. Public places is a very common place that you'll encounter people who need help. Make sure that if you're going to help, you take care of the patient, as best as you can. Focus on the patient and not necessarily the public that's around you, because you're always going to have the public there. And then really also focus on making sure the scene is safe, because if you can't effectively and safely take care of a patient, you shouldn't be trying to, in my opinion, because if you're going to end up hurt, it creates a worse situation for everyone.
All right, and then just an extra question. What could help dealing with panic in an emergency situation?
Remembering your training, taking 10 seconds, a deep breath, 2 deep breaths if you have to, really kind of all the way in through the, your nose or out through the mouth or however you want to do it. But taking 10 seconds to just collect your thoughts is sometimes the best thing you can do. Or if you have a hand, have someone else step in and just kind of be thinking out loud. Because if you're thinking out loud, sometimes someone else can hear something, be like, oh, what about this? And the idea is kind of spitfire.
All right, thank you.